everyone, welcome. Thanks for coming back from lunch. I want to welcome you to the session, Cutting the Red Tape, Strategies for Reducing Administrative Burdens for State and Local Health Departments. I do want to just let you all know that we are kind of testing a new technology. This session is being live broadcast for attendees or folks that weren't able to attend the conference on Google Hangout. So at the end, we're going to take questions from the audience and then also those that are attending live via Google Hangout. So welcome to those in the room, and then also welcome to those on Google Hangout. If there are any technology things that, for those that are on Google Hangout, we apologize. The session is also being video recorded, and NACCHO will release it afterwards. So to kind of set the stage on administrative preparedness, this is an effort that NACCHO, ASTO, ASPR, and CDC have been working on for about 3 years now. We kind of got a working group together and kind of really spent several months just defining what administrative preparedness was and putting some parameters around that. Once we did that, we had kind of conducted interviews with a lot of you all at the state and local level and kind of figured out what are those challenges, what were those barriers that you were experiencing. A lot of them were from things that happened during H1N1, moving the money from the federal to the state to the local level in a streamlined or expedited manner. Once we did that, we kind of categorized a lot of these challenges into areas of procurement, authorities, workforce, reporting, allocation. NACCHO and ASTO have developed resources and tools around those topics. There are different reports and checklists and different things that are available on our website. So you can reach out to me, Samantha Morgan, or Lindsay Laverty in the front row from ASTO can kind of get those resources to you. But really, we're excited for today because instead of hearing from this joint work group, we have a nice panel of I'm going to say mainly local folks, but some of them are obviously ASTO members as well, to present to you best practices that they have implemented in their jurisdictions. So we have representatives from Philadelphia, New York City, and Chicago today that are going to present with you. So I'll read through their bios. We have Mark Cachadorian from the city of Chicago. He's a senior emergency management coordinator and is the Chicago Department of Health liaison to the Office of Emergency Management and Communications. As the emergency management liaison with the Bureau of Public Health Preparedness and Emergency Response, Mr. Cachadorian coordinates routine preparedness and emergency operations between two departments. He is working on a variety of projects and operations, including revisions of legislative authorities, emergency contracts, and a project on mapping vulnerable populations and government services for individuals with functional needs. Mr. Cachadorian previously worked for the Federal Emergency Management Agency, FEMA's Emergency Management Institute in Emmitsburg, Maryland, and the U.S. Department of Health and Human Services, AHRQ, in Rockville, Maryland. Mr. Cachadorian has also worked at Waukesha County Office of Emergency Management in Waukesha, Wisconsin, Froedtert Hospital Emergency Preparedness Department in Milwaukee, and has been a nationally certified emergency medical technician for over 9 years. So welcome, Mark. Next, you'll be hearing from Mitch Stripling, who is the Executive Director of the Bureau of Agency Preparedness and Response and oversees agency preparedness efforts at the New York City Department of Health and Mental Hygiene, including units for planning, training, exercises, operations, and evaluation. He coordinated a citywide planning for the 2009 H1N1 pandemic and is currently part of the coordinating group for citywide healthcare facility evacuation that developed after Hurricane Irene. He served as a planning section chief and co-lead for the healthcare evacuation during the response to Hurricane Sandy. Prior to working at New York City, Mitch worked for the Florida Department of Health. There, he helped plan and implement the responses to 6 federally declared disasters, including the 2004 record-breaking hurricane season and Florida's response in southern Mississippi after Hurricane Katrina. Welcome, Mitch. Jim is the Director of Digital Public Health at the Philadelphia Department of Public Health. Previous to this position, Jim served as the Operations and Logistics Manager for the Public Health Preparedness Program in Philadelphia for nearly 7 years. Jim created and managed the first social media account for the H1N1 influenza pandemic, and in the department, he has managed several other social media accounts since then. He also supports media relations for the department and was the city PIO for Unified Command Hazmat Response. Outside of work, Jim has presented across the country on using social media in emergency situations and maintains 2 regularly scheduled Twitter chats, a blog on emergency risk communication, and a public health meme Tumblr. Welcome, Jim. Without further ado, I'll turn it over to Mark.
All right, so I'm very excited to be here. I am admittedly an administrative preparedness nerd, so I love this topic. I've heard Mitch speak in the past. He's a very energetic and dynamic speaker, so if I put you to sleep, he will wake you up. Jim, I know, has some great materials in some of our conference calls. He has some good stuff for us, so I'm very pumped for this presentation and this discussion, hopefully, as well. I would actually like to offer kind of an optimistic view of bureaucracy and the regulations within government. I was equally as excited when NACCHO decided to name this Cutting Through the Red Tape, because I was thinking, well, I have some materials on red tape as an academic in public administration as well. So I start with a quote. One of my professors, Dr. Murray Feeney, wrote a book with Barry Bozeman on the concept of red tape in government. And I think it's actually a great quote. I'll read it word for word because it's important because it sets the context here. So when someone complains about red tape, it is difficult to know whether the person is bemoaning the amount of paperwork in an organization, tangled rules and regulations, capricious bureaucratic behavior, lethargic bureaucratic behavior, or the sad plight of having socially desirable, effective rules enforced to one's personal disadvantage. And I think that really kind of sets the stage for what we're going to talk about today, because it's hard to tell whether or not some of these administrative burdens or some of what we call red tape is really something that prevents us from doing what we need to do, or if it's something that just sort of seems like a perceived problem or an attitude problem. So I think that's really important. I do want to basically start with authorities. So fundamentally everything, or almost everything we do in government is based on authority in some way, shape, or form. And I think that's critical to the 3 basically routes that I provide as recommendations to you, that these are distributed across this approach, any administrative issue you deal with. I really think it's important to start here. So whether we're talking about some of the mechanisms that I provide for you here, or anything else that you're banging your head against the wall trying to figure out, I think it's important to start with a couple things that I've found have been effective. So first of all, I want to propose that we view legislation as enabling and not restricting. And what I mean by that is if you sit down and you look at legislation, it's really something that enables us as government agencies to do what we do in our business, whether it's a public health agency or an emergency management agency. So because I'm the health liaison at the emergency management agency, I speak very much from the emergency management perspective. So I'm always talking about the authorities of an emergency management agency. And I think it's really important on day 1 of your job or a new position, or really year 10, to go back and take a look at what your authorities are and start there and look at all the authorities from the local level all the way up to the federal level about what's within your lane. So you understand what you can and can't do, you understand what you're able to do, and really look at it as enabling and don't view it as necessarily restricting. The second thing I want to identify is basically recommend to you that you want to identify what's a perceived versus a real barrier. And this one is critical. I can't tell you how many conversations I've had over the period of the past several years where people are saying that we have the authority to do something or we don't have the authority to do something, and they're actually incorrect. And that's why kind of that first point is really important, because you really do need to read. And it seems like something so basic, but something so basic is many times not actually communicated appropriately. So how many of you would say that in your jurisdictions you have the authority to, for example, tell citizens to evacuate forcibly, to say you have to evacuate? So see a couple of hands, all right? So I can't tell you how many conversations we've had where, and not necessarily just the city of Chicago, but in general in emergency management, where people are saying, oh yeah, we have the authority to do this. And you're like, okay, where? Where does that authority exist? So evacuation is big. A lot of people think, oh yeah, we can tell people to get out of an area. I was like, well, show me where in our legislative authorities. Show me where in our city ordinance does it say that we can do that. And that's across the board. So I think it's critical. Those regulations at different levels, even state administrative code allows us to do certain things at the local level. So really tap into that and tap into your legal representatives as a resource to be able to identify some of those real versus perceived barriers. Next, I think it's very important to understand the history and the purpose of your agency. So this is critical in emergency management. I'll talk about this in a minute, but emergency management is supposed to be fulfilling a multi-agency coordination role. And what I mean by that is when you look at the history of emergency management, the gap it fills is that multi-agency coordination role. And that's the purpose. That's how the agencies evolved and came to be what they are today. And that essentially establishes the background for why you're doing what you're doing as an agency. Why some legislative body somewhere or some city council said, we're going to create an agency, we're going to give them authorities to do something. That's where that's coming from. And it really is, I think, incumbent upon us as administrators to understand that. Finally, recognizing the purpose of government regulation. So I know it's difficult, and I know some of you are going to probably challenge me, which I mean, go for it, because I think we need to have this a challenging conversation. Don't let me get off easy. But really the purpose of some of the regulations that we see are actually part of the checks and balances that are natural within government. That's really our responsibility to make sure are there. You never want to come into someone at a procurement office and say, we want to circumvent the process in emergency. Don't ever say that. Don't ever say that you want to circumvent the process, because that process is there to establish that transparency. I realize it's not always going to make sense. We may not understand that process, but recognize that safer hiring. I know Mitch is going to talk about this in a bit with personnel and so on, so I won't go into too much detail with it. But a lot of the job securities we have as government employees are there so that a politician can't say, okay, show of hands who voted for me. All right, everybody that didn't, you're out, you're done. And that's why that insulation is there for some of those job protections. So understanding these things and kind of approaching some of these problems just across the issues of administrative preparedness are really, I think, the starting point for being a little bit less frustrated with these things. I'm not saying it's a silver bullet, but it really does help. So in the city of Chicago and the public health department, we really rely on the relationship between the emergency management agency and the public health department for preparedness issues. So I'm going to talk about a lot of the authorities with regard to emergency management, and that's because the public health agency really takes advantage of those authorities. So if we need to be able to do something with an expedited purchasing process, we're really doing that via the emergency management agency. And that's kind of an important element to really the context of the three proposals that I have for you here. So I'd like to propose three methods, in a sense, to approach some administrative obstacles. And really, in some way, shape, or form, get around them. In summary, I want to work through the system, typically in advance, which is really good because, again, we don't want to just circumvent the system for folks that really want to make sure that we're checking out the boxes that we need to. In some ways, we can work around the system. I use the term around with a grain of salt, which I'll explain. And then finally, there's always the option of changing the system. And there are ways that we do that, and that's part of the process of government. So to begin with, working through the system is probably, in the preparedness environment, one of the best things that we can do. I put the in advance there kind of as with a little bit of emphasis, because when we're talking about contractual relationships, it's something that will take time. And again, it takes time and it takes energy, because we don't want someone just going and saying, hey, I'm going to hire my uncle to do $10 million worth of work. That's not appropriate. And even in an emergency, that's not necessarily appropriate. So to the extent possible, I would ask you to look at your authorities and talk to your procurement folks, talk to your law folks, and talk to anybody else that you have to talk to and say, we want to make sure that we are following the appropriate processes and we're following the rules. But to what extent can we do them in advance? And that's kind of where the pre-qualification of vendors, pre-qualification of anybody providing any sort of good or professional service really comes into play. And if we can do these things in advance, we can really basically just hit the go button the second an emergency happens. And we're really not circumventing anything. We're not going around any process. We're basically just, to a certain extent, almost pre-scripting what we're looking for. So with regard to the contractual relationships and kind of the pre-scripting of some resource requests and so on, I would encourage you to, and Commonwealth of Virginia is probably going to love me for this, but Virginia Department of Emergency Management at the state level does a phenomenal job of setting up standby contracts and pre-qualifying vendors to do emergency-related services, anything from debris clearance to personnel, mutual aid type MOUs and so on. I would really encourage you to reach out to them. They have wonderful resources on their website, again, Virginia Department of Emergency Management. And they really, in my mind, based on the folks that I've interacted with, I've seen present and talk about these things, they really are, I think, top-notch with all their authorities. And they do trainings on their, how to use and access their contracts. They do all sorts of great things, and I really would encourage you to do this. I think this is certainly we've seen promise in this on the City of Chicago side, and really it's a matter of, again, not saying walking into our procurement office saying we're going to circumvent the process. So there's nothing that we can see that really is a significant red tape type barrier to doing the pre-qualification of vendors. You're going through the process. So to what extent can you go through that process and leave those contracts in place? Again, with pre-scripting resource requests, I think this is also, Mitch is going to cover this in detail, but to what extent can we pre-script things? Can we interact and put things down on paper before they're going to happen? We've done so much modeling. We know how much, how many casualties we'd have if a certain amount of anthrax was released in a certain way and at a certain time of day. So really, there's a lot of things that are very predictable about these disasters that we might actually encounter, and I think that pre-scripting really allows you to do that. And I know Mitch is probably going to hit a few points of that as well. The second option I would recommend is working around the system. So I use the term around, again, in quotes, with a grain of salt, because I don't actually recommend that you circumvent any government process, right? I'm not promoting that anybody does anything illegal, okay? But what I mean by this is viewing coalitions, viewing COADs and BOADs, voluntary organizations, and viewing private sector partnerships, public-private partnerships and task forces as part of the system. Okay, now I'm also not recommending that we're outsourcing things like government, okay? That's not what I'm recommending. But what I am saying is that, FEMA promotes whole community planning and so on, but really what you have to do is kind of take a step back and look at the capacities that are created external to our formal government employees and bureaus and agencies, okay? So there's nothing as a government agent that prevents me from going out and interacting with the healthcare organizations, healthcare coalitions. There's nothing preventing me from getting 75 agencies at the table in a COAD or a BOAD and having them act as a planning body. And there's nothing preventing me from interacting with the private sector and preparedness. And in fact, we're actually required to do that through our grants. So that's one of I think the big things that we don't necessarily see as an obvious, as an obvious planning tool or capability development tool. But the example that we have here, and this is actually the picture that's on the slide, is a picture of a multi-agency resource center in Illinois. We had some tornadoes come through a little bit several months ago. Essentially what that multi-agency resource center is basically the operational component of the statewide BOAD and some of our regional COAD capacity. Now, this didn't happen in our jurisdiction, but all of the folks that you see there, with only a few exceptions, are actually nonprofit agencies. And what they did was they used all of this planning that we do on a day-to-day basis, and they put all these folks in the same room together after a disaster happened and offered resources that really almost had nothing to do with government to survivors of that disaster. So all they needed from the government was basically just support and coordination. So it doesn't cost the government necessarily anything to say, hey, nonprofits, do you want to give? We just have to make sure we have those administrative processes done ahead of time, talk about voluntary liability issues and so on. But they're donating, and they're doing it in a coordinated fashion. So really all they've asked of us is a certain level of coordination, so we know what facility we can choose, where we can put a facility. It doesn't have to be a government facility, but we know if government's involved, we have to have any considerations taken care of. But really, it involves so little effort, relatively speaking, to coordinate with our monthly meetings of our COAD in Northeast Illinois, where we have routinely 35 to 45 folks, agency representatives that come to the table and have amazing conversations about all sorts of resources that they have, that they pull from all of their parent organizations, that really, it's no financial commitment on the government's part with the exception of paying for the time for us to go to these meetings. And we view them as a planning body. They're right now working on a multi-agency resource center plan. They're working on a long-term recovery plan. And what they were able to do was, in the past year, we had some flooding last spring. They actually stood up a case management capacity to track the hundreds of people that we had in vulnerable populations who had moldy basements. You had elderly folks living in moldy basements. You had individuals of low income that couldn't afford, even with the FEMA money, to do the muck out and repair and rebuild that they needed to do. And the COAD, much faster than we could ever do, was actually able to create that case management capacity on the fly. So they did this, we probably would have taken the equivalent of years in government to be able to do this. They ramped up, they did it on the fly, and now they're receiving sustainment grants from their parent nonprofit organizations to sustain that case management capacity. So really look towards those external entities to provide that return on the collaboration that we're really kind of seeking in some of these coalitions. So I do propose that when all else fails, change the system. And what I mean by this is that you have to consider it as an option, that you can go and you can look at city ordinance, you can look at your state administrative code, and you can consider the option of actually making changes. This is important, and this is kind of where that history comes into play. So I'll give you the kind of background of emergency management and why that background actually should help us inform whether or not we think that we should be making changes in our ordinance or administrative code or wherever we're working. So the piece that I put on here is that there's a multi-agency coordination piece of emergency management. So back about a little over 100 years ago, it was really not the business of government to get involved. Even when a private dam would break and kill hundreds or thousands of people, government didn't really do anything. Government didn't really have a role to regulate that, to go in and somehow do what we now expect it to do. So over the period of several decades, by the time we get to the 1970s, we have all these programs in government that basically are somehow geared towards disaster preparedness, disaster response, recovery, mitigation, and states found it very difficult to navigate. So states are like, hey, you got all these different programs, all these different agencies, bureaus, departments, divisions that are dealing with something related to emergency management, and we can't navigate it all. So what the National Governors Association proposed was that we establish comprehensive emergency management at each one of the counties, and then you have one emergency management agency at the federal level, the Federal Emergency Management Agency, that was responsible for coordinating all this. So recognize that the history of emergency management, and largely why we are where we are today, is because emergency management is supposed to fulfill the piece where no one else was really responsible for. You know, police does police's job really well, public health does public health really well, fire does their job really well. And I'm never going to go in as an emergency manager and tell them how to do their job. But no one was really responsible for making sure everybody was working together towards common objectives. So that's why we are where we are. But then also recognize too, that as Claire Rubin states, the general history of emergency management and emergency management policy can basically be described as a series of focusing events. So we have a disaster, and this is no surprise to you. We have a disaster, everybody gets up in arms, we say never again. And we create legislation that somehow retroactively was supposed to solve the problems that we dealt with, right? And then of course we go on and we have funding allocations, we spend the money in temporary grant funds, and then we have another disaster, right? And then they say never again, and we deal with the same problems, and we go back to that cycle. And really the policy is very much informed by each of these disaster events. And that's important to understand. So we recognize that that's where a lot of this policy has also come from, is that we have disasters, we see problems as a result. So to be more proactive in a policy environment, make those relationships with your legal team, your legislative teams, so that you can make sure that if you go through and you read your legislation and it doesn't give you the authorities that really you need to have, see if you can make changes to it. What I also hear a lot too, in general, is that people say, we don't want to get the legal team involved because they're just going to slow down the process. So let's wait as long as we can to involve the lawyers, to involve the legislative people, because we know they're going to slow down the process. And my response to that is, did we ever think that if maybe we involved them from the start, they could do a couple key things for us, we could do some stuff for them and make sure we're adapting what we need to do. We'd go through that process and it would move faster ultimately at the end. They're probably slowing down the process because we ignored them through the months and months or years or whatever it might have been, trying to make a revision to an ordinance or trying to make a plan revision that we're trying to pass through or an MOU, and really they should be involved from the start. These things are so basic, and there's nothing I don't think that I'm saying here that you guys don't already know, but these things are happening, these things are slowing down the process, and I do recommend that as a part of what we do as administrators, our job is also to inform the policy developers, the folks that are looking at some of these issues, and really kind of say, this is why we're here, this is our mission, this is what we're supposed to be doing. And do it with that understanding that this is the way the system works. This is part of the process in government, and we need to be thinking in that direction. So I will leave you with that. There's my citation, and hand over to Mitch.
Thanks, Mark.
I totally believe in circumventing lawyers.
I do this totally unofficial, non-work related podcast with my buddy Andrew called Dukes of Hazzards, and which is not related to the show. You know, it's Georgia, right? So you should. And I was telling him we were doing this session at the summit, and it was a Google Hangout, and he was like, "Oh, that's really awesome. What's it on?" And I told him, and he was like, "That is the most boring topic that I have ever heard for a session." And here's the reason I think he's wrong, right? Is that this stuff is really the fundamental infrastructure of emergency response. Okay, these are the things that nobody wants to think about, that are not like the sexy things, but that are the things that really underpin all of the things we're trying to do. And my big sort of takeaway message for you guys is that in my experience, you can't cut through red tape. It is not possible. Once you're in a situation where the tape is in front of you, in an organizational sense, I mean, sort of building on what Mark said about the tape being part of the bureaucratic structure. Once the tape is in front of you, you're done in an emergency response. You have to own the tape beforehand, right? You have to acknowledge that you are government, you are the tape. and by acknowledging your ownership of the tape, then you can sort of get rid of it, right? And make sure it's not there in your way in an emergency when you're trying to get stuff done. So what I'm going to give you are 6, I think, very concrete ways to sort of own the tape so that you don't have to cut through it when the time comes. This is one, okay? You need to name the emergency roles of all of your staff, and you need to, if you have this capability, store them in a database that you can access. Very simple. I'm going to give you an example of ours. This is a screenshot. That's my picture in the corner of our employee data bank, which stores the information of all of our employees. Now, the system is less important. I know this is an IT system. People have different capabilities to build this, but there are a couple things that are important. Before I tell you what they are, we've done a lot of things in New York City. We have amazing countermeasures planning. We have a whole disaster planning framework that I'm teaching a course on here tomorrow. We have these threat response guides for executives. To my mind, of everything we've done, the single biggest achievement that we've made is this system. Because here's what it allows us to do. I'm going to zoom in a little bit. So it has on there the specific emergency response role for every person in the agency. It has their ICS section, it has the group and the subgroup that they respond in, it has their pod assignment, and the specific pod with the address and the manual that are assigned for that pod. So what that means is that when we turn it on, we activated yesterday for measles. I don't know if you've been reading about measles in New York City. We have an ongoing outbreak that we're activating for, and so everybody that runs an ICS section has a roster of people that they own. As soon as the commissioner activates the incident command structure, they can pull those people because of those roles in the EDP. Okay? And that gives us tremendous clarity about everybody's assignment. And it cuts down on people not responding, right? There are all these debates about when people respond and when they don't in emergencies. The biggest way you can make sure people respond to my reading of the research is by giving them a specific role and making sure they know what that role is. So you make a list. Second thing, it ties in with our emergency notification system. So everybody in the EDB, it has your home number, it has personal cells, it has texting ability, so that when we do, if you have Dialogics or SendWord Now or one of these notification systems, that information is in there updated with a survey about what your skills are that we make everybody fill out. You know, do you speak Mandarin? Are you a licensed truck driver? In the city of New York? Do you have skills that are not related to your job? Maybe you work in administration, but you have an epidemiology background. Well, we need to know that. So all that stuff is tied together. Third thing, it has a list of all of the required trainings and certifications for your role, right? I'm a planning section chief, I've got to have ICS 300, all that kind of stuff. If I'm an EPI, it would have EPI certifications there. If I were a financial person, it would have those trainings listed there. So basically, this is a portal for both what your role is, how we contact you, and what you need to make sure that you're successful in your role. So we're coding the response DNA of the health department through having this system. And if you can't build a whole IT system, keep it in Access, keep it in Excel, but you need this, because the thing that will slow you down most in an emergency other than executive political decision-making, which is like the number one thing that will always slow you down, is not having clear assignments and having to make them up on the fly in the first hours of an emergency. So code this DNA, you're halfway there. All right? Second thing, you should put emergency preparedness and response in employee tasks and standards. Do you guys have these documents for employees in your health departments? Most organizations, they have just, when you're hired, you have to sign a form, right? And the form says, here's what I'm responsible for. We put in our form a thing that says emergency preparedness, which means that every employee has to participate in emergency preparedness and they have to participate in emergency response when they're called upon. That's really important. Very simple thing to do with HR, but once you do it, you have a lot more leverage in making sure people respond when they're needed to respond. Okay, that's number two. Number three, Mark touched on, develop pre-scripted mission requests for your operations. So one thing that happened to us after Sandy is that we had an entirely new operation thrust upon us, which is canvassing vulnerable populations in homes without power and heat. And we'd never done that before. We're a health department, right? We don't usually do population canvassing, but it was given to us, and we took it on. And now we're planning to do it next time, right? Because once you own something, it's never going to go away. It now is yours forever. But what we've done is, through our operations director, Ray Lynch, he's developed these pre-scripted mission requests for the specific logistical and support needs, and we're having them pre-cleared through the city and the state and the National Guard, because they're surge resources. Because the thing that I hate most in a disaster about resource requests, I don't know if you've ever been there, sometimes you'll write up a mission request form with logistics and you'll send it up and somebody will decline it because you put a comma in the wrong place or something like that, and they send it back and 24 hours pass, 24 precious operational hours go by while you're sitting there waiting for the paperwork. You never want that. So you want to pre-write these mission requests, get them approved up the chain as far as you can so that they're quick when they happen. So this is an example of sort of just our OEM form kind of grayed out with the list of those pre-scripted mission requests we have in place based on these contingency contracts that Mark's talked about. We've done a lot of work on that too in the past couple of years. All right, so number 4. And this is a big win for Monica Marquez and her staff. She runs our Bureau of Grants and Administration. Plan with finance like you would with EPI or clinics. One thing about the CDC capabilities, the FEP HPP capabilities that I love is that they're operational and they're specific, but they also are public health focused, which means sometimes they don't focus on these core financial instruments that underpin stuff. And so we don't focus on it. We're out doing countermeasures, we're out doing healthcare outreach, which is critically important, but you can't neglect your financial partners. This is an example of a draft timesheet that we've been working with finance on that is very simple, but solves a number of problems. Here's the thing about a workforce. We have a complex workforce. We have 6,500 people that work for our health department. Of those, we have maybe 5,000 who are full-time employees. We have 1,100 that are contractors on about 120 different contracts with different stipulations about how you can use them based on their grant requirements. So you think in your head, oh, well, it's an emergency, I'll tell everybody to respond, and then they will, and they don't, because everybody has a different understanding of what their job is. So our finance team has been working on a set of PS policies, personnel policies for people, to be clear with them on these things, which you're not going to think are critical emergency things, but totally are. How you bill overtime, when you get it, when you don't. Working at home, when you're allowed to telecommute, and when you're not, and for what jobs. For a contractor, when that person can be deployed and for what hours in an emergency. These are all really key things. The biggest thing that we've been able to do with them, based on this timesheet work, is a call script. Because here's the secret, and I shouldn't be saying this in a Google Hangout probably, so nobody listen, turn off your speakers. Okay. Is that we can't actually compel people to do emergency response, right? It's in their tasks and standards, but we can't force them to respond in an emergency. We can't get out cops and drag them in. But we can expect them to respond because it's in their tasks and standards. So there's this weird dance. So based on that dance, we've developed a call script, which it goes kind of like this. You know, you're in the EOC and you call somebody up and you're like, hey, I need to go to a Podmark. And the person's like, oh, really? When is that? And they're like, Saturday morning, 9 a.m. And they're like, oh, I'm busy, I'm sorry, I can't do that. So here's when the dance starts. So you say, oh, well, you know, it's in your employee tasks and standards to be an emergency responder. The person's like, oh, is it? Well, I don't care, I'm not gonna come, I need to sleep in and watch cartoons after I sleep. And then you're like, okay, well, you know, we're compiling a report for the commissioner of everybody that didn't respond so that we can show who's, you know, adhering to their tasks and standards. And, you know, the person's usually like, I'll be there at 8:45. And it's important because people in general actually are working for social good, right? I'm being a little flippant. They're willing to respond, but they need to make sure that there's sort of a clear mechanism. And this kind of call script gives us a clear mechanism to deploy people and when we can deploy people. It's also different for employees and managers, right? You can pretty much deploy managers anytime for anything, but if you're a unionized employee, there are very specific contracts. And so working through all these things really speeds up your response time exponentially in those first hours. So just a couple more. Whenever you start a response, whenever you mobilize ICS, bring finance in immediately. We used to had a pattern a while back where we would call finance, we would ask them for an overtime code so we could bill overtime, and then we wouldn't talk to them until recovery. It was bad habit. And so now what we do is we make sure whenever we start an initiative, finance is there immediately at the table with some clear initial objectives that are both about overtime, that are about paying for resources, and that are about getting contract mechanisms in place. And it's a form of forward planning, right? You get this in place, then you don't have to worry about it. So the last one is that, and this is tough, you need to make sure that you are defining the projects you need before you have money for them. Especially in recovery, it cannot work the other way. If you wait to get money and then think about what projects you need, that's how you get written up in the New York Post and called out for things happening too slowly to do anybody any good, right? You can't do it that way. You've got to start with the need, define projects, and then you go shopping around for money, and finance is great at this. Working with your finance folks, it gets them involved in emergency response, gives them a clear task, which is finding a funding mechanism, which is something we're all looking for. So as an example, in New York City, we had something called the SIR project, which was something that Mayor Bloomberg did, laying out about $350 million worth of community development block grant funding, was what this was for. But before we knew there were funding, what we did was we sat down and we said, what projects are needed? So working with our team of finance folks, we developed this list of projects, which are hardening nursing homes, hardening clinics, hardening mental health clinics, all the things you would think recovery funding would be for. And because we had that list of projects in hand, that meant that when the funding came, we were ready to put them out there, right? They were shovel ready, is the phrase. And so they could be taken up. And we did a lot of work putting into the report this idea of a resiliency coordination working group, which is a kind of a break the silos group, get administrative folks from all over the different agencies together so that they could own the red tape beforehand, right? We got the people that own the red tape in a room together so that then they wouldn't, use the red tape to get in the way of the rest of us. They were coordinating with each other, and that let the whole process sort of work more smoothly. But it only worked because they were there in the beginning, like the lawyers, right? So we could devise the projects with them so that later on they didn't create any roadblocks. So these are my 6 concrete things for you to own the red tape that used to be in your way. Thanks.
I'm encouraged because we had no clapping at remark and a little bit of clapping at remark. I'm expecting a standing ovation. Good afternoon, everybody. The first 2 presentations we heard are, in my eyes, completely eye-opening. It really leans very heavily on what we traditionally consider administration, finance, and personnel. What I'm going to talk about is a little bit different. It's getting into the communication side of things. Because I think, as we read after action reports of what goes on in emergencies and exercises, the first lesson learned is always communication failure. And I think that there's a lot that we can do, maybe not from what we say, or what we say perspective, but how we say it and how we organize the people who are talking. That we can cut out, maybe not red tape so much, because there isn't really administrative, it's not keeping us from organizing this way. These are just innovative practices that folks around the country and folks in Philadelphia have started to implement to facilitate communication in an emergency. So this is the quick overview of what we're going to look at. Starting off with the background, because I think it's important to set the stage. I think that anybody who's been to any of my other sessions can see that I've been talking about social media already, because I think social media is changing the way that we communicate. And when you put it in an emergency context, it makes it even faster, it makes it even more scary for a lot of our traditional communicators. And I want to point this first example because I think that this is such an amazing thing. There was an earthquake a few weeks ago in Los Angeles. It happened at 6:25 in the morning. And if you read the line here on the bottom, it says the LA Times posted its earthquake story within 3 minutes. 3 minutes after an earthquake happened, there was a story on the LA Times website about the earthquake. Now think of your PIO, what do they usually do around 6:25? Think they can respond within 3 minutes? Can they comment that quickly? No, they can't. And what's interesting about the story isn't that there was a reporter sitting by the computer ready to go and he felt the building shake and he started to type. This story was generated algorithmically. They had a computer program that was running at any time an earthquake happened within a certain pre-designated area. It automatically pulled the information of the earthquake from the internet, put it together into a legible, human-readable story, and automatically posted it to the website. Like I said, faster than ever before. On the other hand, broadcasting, though, is becoming more ubiquitous. There's more people are broadcasters. It's no longer just the traditional media. This is a pretty famous photo. Everybody remembers this. This was taken after Delta Flight 1549 crash landed in the Hudson River. Now, there was a timeline study done of this event because everybody wanted to find out how quickly things actually happened. And this picture was posted online and circulated around the world 1 minute before the first FDNY boat hit the water. Interesting story from the day. The chairman from Delta was on the phone with CNN about to give an interview, and he couldn't get through. He was on hold for about 15 minutes because CNN was interviewing the people on the boat. So think about that. That's what our PIOs are looking at now. No longer are we that first most important voice. We're now secondary, and we're about 10 or 15 minutes behind the curve on the best day. That's only going to get worse. This is a scary one because with the rise of drone technology and those mini helicopters, and people strap a camera to them and they can go flying over disaster scenes. Take pictures of our students before our folks have even been on the ground. Now imagine having a comment with footage of what's happening in the middle of a disaster and we don't even know what's going on there. These things will happen. You will get questions about this. Online crowdsourcing. Everybody remembers Reddit was a big thing to do with the Boston Marathon where they misidentified someone as a potential bomber. Well, they've ramped it up and they've created this widget that news media now can import and place right on their website. So all the people who are on Reddit making suppositions about your disaster or your emergency are getting funneled directly to the front page of the newspaper. It's getting faster, it's getting bigger, it's getting worse. What do we do about it? I want to start and talk about joint information systems. Now, that's a less well-known term for folks who work in communications. Usually they think about JICs. Everybody knows what a JIC is, right? Joint Information Center. A Joint Information Center is very nice, and it looks very good in a plan, and we have very good templates about how to organize a JIC. The problem is, though, I would argue JICs are too small. When you have disasters that look like this, you're 6 and 7 people in a small room, because the JIC is always the smallest room in the EOCM. It doesn't work anymore. It's too small, it's too time limited, it's too space limited. So I give you 2 options. The first is this idea of a regional joint information system. Now, this is unusual because most people, when you write your Joint Information Center plan, you talk about your PIO, you talk about your media relations folks, and you talk about your risk communicators in the department. Well, as we can see from the Hurricane Sandy threat swath, disasters aren't local anymore. They're regional. We depend so much on everyone else around. And both of my colleagues talked about making those pre-arrangements and making contracts and making mutual aid agreements with the people around you before the disaster. This is the point when we start to look outside our traditional communicators, the folks we think that we would stick in front of the camera, and say, there's lots of people who are trained to do those things around that wouldn't be involved in a health emergency. We have a gas works in Philadelphia with a public health emergency. They may not be the ones in front of the camera, but they have an entire team that does this stuff every day, and they're very, very good. Why aren't we partnering with them now? And don't even think just regional within your own area, think beyond that. People in other counties, so even if the disaster doesn't go into a county around yours, again, those are folks that UPIO should know, work with regularly, and be confident enough to be able to call them in an emergency and support that joint information system. The second part is volunteers. Now, the idea of using volunteers for communication scares everyone. You ask your PIO if he wants to use volunteers, they will run away. Because we all know volunteers are great, and except they tend to run on and they're on the camera. Well, I'm going to give an example. This here is a picture of Shadow Lake, the map of the wildfire in Shadow Lake, Oregon. Happened a few years ago. It was a huge fire in the middle of nowhere, threatened very few people. The PIO who was assigned to this from National Wildfire Association was a woman named Chris Erickson. And she wanted to try something new. Because it was a low priority fire, she wanted to see if she could utilize volunteers to help support the public information efforts. Not making messages, not talking to the media, just a number of someone's getting online and looking to see what the internet was saying about their fire. As you can imagine, there's these conversations going on already all around the world. And it's the PIO's job to deal with the media, less so with online conversations. So she wanted to give it a try. The team was called Oregon Fire Info, and it was a team of, I want to say, probably 7 or 8 people around the world so they could have 24-hour coverage. And they were all emergency managers, people who do this work and work online. And they came upon this blog, hindsight.blogs.com. This is a tiny little blog. I don't even know if it exists anymore. It was just this gentleman, Mr. Hines, who liked to talk about things that were going on in the middle of rural Oregon. And when there's a fire there, you need to bring in big trucks with lots of stuff on it, right? Well, the facilities in this rural area can't handle these big trucks. And he went on a tirade. Took pictures, ranting and raving, several posts in a row, all very, very discouraging about the fire response. Because, and from his perspective, it's right. They were potentially disrupting the community there. Now, from the PIO side of things, don't you think CNN or Fox News would love to get a handle on this and do some interviews in that community about how the federal government is coming in and running roughshod over their community? Well, they found this in the middle of the night as this man was posting and posting. Reached out to him, connected him with the PIO. The next day, the PIO and the IC went out, met with the man, addressed the concerns of the community, rerouted the logistics lines, and saved the community. All before CNN, Fox News, MSNBC got on the horn and started taking up all of the PIO's time. She could now deal with the fire and not this much less important thing. So I would encourage you, if it sounds interesting, if you look up Shadow Lake VOST, V-O-S-T, there's a white paper written. VOST stands for Virtual Operations Support Team. It's just people who are online around the world doing social media monitoring for it. Now, we've taken this in Philadelphia, this idea, because my executives weren't too keen on the idea of contracting with emergency managers around the world. But we thought, well, we have volunteers that we already trust, that we've already vetted, and we've already worked with. So we tapped our MRC, and we've gone through a series of trainings with a number of them to act as these social media monitors. Sure, they may not be able to come in and help with skilled nursing care or be able to stand in line in a pod, but they can get on their computer, they can get on their phone and just do searches for terms that are associated with our disaster. And it amazingly bumps up the number of people who are working on our joint information system. We've got now potentially everyone in our MRC can help out with it. Now, I'm talking a lot about using people regionally. I'm talking about using volunteers from around the world. It's really tough, especially when, again, your JIC is in the smallest room in the EOC to get all those people coordinated. So I absolutely, as people are thinking about how to organize a good information system, think about virtual tools. The one that we use for our MRC boss is Google Drive. It's just an online web editing software. You have basically Word documents online. And we only share the particular document for the emergency with those people who are responding. Now they can make all of their notes and everyone who's on the team can see it. As we make changes or as we approve new facts, they get put on there. Everybody's on the same page. It's a great way to organize those disparate teams because simply put, we can't all be in one place at one time. It saves on facilities, it saves on IT upkeep to do this virtually instead. Incident websites. Does anyone here in their plan have a plan to develop an incident website? Something blows up in your county and you're going to set up a brand new website to handle that. It's unusual, most people don't, so you're okay that nobody does. But I want to bring this term to your attention. Distributed denial of service. Now, for anyone who's a computer hacker, and I know there's nobody here, this is what happens when someone hacks a website and the website goes down. Everybody's heard of this. There's a hack going on, some bank's website, and nobody can get access to it. Well, this is the official term for it. It's distributed denial of service attack. And what that means is the hacker has taken over tens of thousands of computers around the world and told all of those computers to go to this one website. And the computer servers can't handle it, all that traffic. Now think about your government servers. When's the last time you guys updated those for the websites? Probably been a while, and there's probably not too many. Now what happens in an emergency, though, is the public essentially does a DDoS on our website. When you have an emergency, what's the first thing everyone does? They go to your website for the latest updates. And I'll point you to Calgary, Edmonton, which had huge floods last year. They had experienced a very similar thing. Their public information plan was excellent in that they went and had it, their plan was to post all of the latest updates, what roads were closed, what roads were open, where to go, where to find fresh water. And then everybody did what they were supposed to do and went to the website for the latest update. And then it crashed, and no one had access to that information. So what they did was they rolled back and started posting on Twitter because they had already identified that there was a need to get the information out and they couldn't do it any other way. Another solution, one that I prefer, is this idea of using an incident-specific website. Now, it's really difficult to get websites set up and funded and new servers built into the network. I would argue there's people out there, there's companies out there that already allow people to set up free websites that handle all the traffic in the world. They're blogs. Now, think of the way a blog works. It's essentially a reverse chronological order time. When you post a new update to it, it goes to the top of the page and everything else gets pushed down. Doesn't that method of pushing information to the public make sense? People go to the site and they see the latest information, the most important information. You can post as often as you want. You don't have to go through IT. In Philadelphia, they do a great job, but it still takes 2 days to get a website update. That doesn't help in an emergency. But through these blogs, it's very easy. We can do it all ourselves. There's absolutely no IT upkeep. There's no cost because they're free websites. You can pay a little money and get some bells and whistles, but when you're in the middle of an emergency, you just need to get information out. These services handle that. Now, I started this section talking about websites going down. These websites are backed by bloggers, backed by Google. They have plenty of servers. They don't ever go down. You can have everyone in the world come to these websites, and there's enough servers and virtual servers to handle the load. They do not go down in an emergency. WordPress is another one that manages about a third of all the websites in the world. They don't go down. You will have a dedicated, easy to update, cost-free way to push out information to the public using the services. Then the big one, approval process. How long does it take to get a press release approved in your department? Nobody ever answers that question. They always just laugh. Traditionally, in an emergency, this is kind of all the people who have a hand in it. And this doesn't even take into consideration political considerations. When the mayor wants to add things, when the legislature wants to add things to the press release, and make sure you're using the verbiage that makes them look good. So many hands in the pot that it slows things down. In Philadelphia, especially around public health emergencies, because, and I think this is the reason we're allowed to do it, because our emergencies are so specific and so subject matter expert focus, we've changed it to this. The IC approves facts. This happened. These number of people are sick. This is the location of the event. This is where people can get more information. And then we leave it up to our public information folks, our public education people, and our risk communicators to take those facts and write messages about them. Now, the way we were able to sell it was, these people do our risk communication every day. They're very, very good at it. And if they aren't good at it, they probably wouldn't be in that position. Does it make sense for 17 people to touch a tweet? Absolutely not. But if all of the facts within that tweet are correct, what is the harm in pushing that message out? So it's a sea change, and a lot of people don't like it, especially on the political side. But in an emergency, it cuts out, and I guess this is probably the biggest example of red tape, of all of those hands touching this information. Thank you very much.
We're gonna take questions. Go ahead.
Hi, Andy from South Dakota. With the websites you were just talking about, the free blogs and whatnot, how do you keep it authentic? That someone else didn't just jump in and grab DOH.SD. whatever and is now, I guess, spoofing you?
The question was, how do you prevent, for some of these incident websites, how do you prevent someone else jumping on and essentially grabbing that website name so then everybody goes? A great example is, people are pretty good at this. After the Joplin tornado, the EF5 that went through, a very famous Facebook page was set up. On the side of right, they were trying to help, called Joplin Tornado Info, which was, because when you look online, you want info on Joplin Tornado, and that's where it would take you. It absolutely happens. And I think that what needs to happen internally as you're developing what this website name is you get to define what it's called, at least to some degree. The media will certainly try to call it the storm of the century or Frankenstorm or something like that. But I think it's incumbent upon us to be able to learn how to set that stage and not respond to it. So instead of us going along with what the public is saying, if we think it should be called something else, it should be called H1N1 instead of swine flu, that's where we would start. And essentially it sets the frame for what your response would look like and what your name should be. And if it doesn't correlate directly to it, you still have the ability to put that name in all of your press releases, mention it in front of the cameras every time your executive gets up there. Again, it's the ability to be able to manage that and set the frame for your issue.
Joel, we and Mark Associates. I was wondering if your work group over time has actually worked out and defined the functional requirements of administrative management. A lot of people, will look broadly at it, and many of the presenters today, touched on various aspects of what is involved in it. But I think it would be very useful as an enterprise to actually see what it is that you need to do to manage people, what it is you need to manage partners, what are those things that have to be done, and then other people can basically start to work on that.
Can I ask, do you mean, so he was asking about the definition of administrative management in total, giving us kind of a mission for that was comprehensive.
What are the pieces of it? I mean, you got into some of that.
And I guess my question is, do you mean for emergency preparedness specifically, and do you mean in preparedness or during response?
In preparedness and response. Right.
So and this is sort of what I was saying about the capability process. So, CDC's capabilities are based on Homeland Security's target capabilities, and you guys know that, which include a set of core capabilities. Planning is a core capability in that model. What isn't a core capability is administration. And I sort of think that the way to do this would be to have one of our core capabilities be how we manage things administratively, to give us some metrics for that, assigning specific emergency roles, having contingency contracts in place for these various things. I mean, I think that it's one of those things I would sort of like a federal rubric to be, because I don't know of a definition for it, and I feel like the capabilities would be the natural place to do that. That's not a great, we don't have one of those that lists all of the comprehensive elements of it. And it does get us into trouble into both, because one of the major things in emergency that happens is unclear task delegation. Who owns this emergency job? And it would be great for us to have as a metric when those things should fall in administration and when they don't. So I guess this is me advocating on.
You suggested in your example a directory of employees. How did you know what to put in there? And how did you know how to build it, where to put it, and things like that? So if you wanted to scale your capability to others, how would people either build it or obtain it? They would have to know what the functions of that are.
And I think, so the question was, how do we know what to put in our emergency database and how to sort of scale it up? And we learned through long, painful experience. We just kept doing things wrong, starting when these grants and things first came in and we started setting up the system. But one thing we had was we had the preparedness cycle. And the preparedness cycle says what you need is you need to have a plan, right? People need to know that plan. You need to organize and equip. Those are the parts we don't talk about as much. You have to organize what people's roles are. You have to make sure they have the right equipment. And then you have to make sure that they have the right training. You have to evaluate them. So what you need at a core base is things in your data bank of employees that meet each of those elements of the preparedness cycle. So that's where we got, here's how you notify them, here's what trainings they need. We have, I didn't really show it, but we have a roster of all the assigned equipment to each employee and what's checked out to them. And so, you have sort of bureaucratic requirements for all these things too. If you give somebody a laptop, you want a note on a piece of paper somewhere that they have a laptop. And it becomes a dual purpose system because it helps you both every day and then it helps you in emergency response too. So I guess what I would say is go back to the preparedness cycle. See what you need for each step of that, and you can build up this framework of data based on that.
Well, who has administrative responsibility over that website, and what type of access do your employees have on a daily basis? And say, in the case of an event, this is my job, and familiarize themselves with that.
Yeah, that question took like 18 or 19 months, for us to figure out, right? So the way we do it is that only about 5 or 6 people have access to the whole shebang. Because there are things in there are social securities in there, numbers in there, there are things that are HR specific. So like our executive deputy commissioner and a couple of IT people and our operations unit, the people that own the emergency notification system. We granted them through a non-disclosure agreement process access to that whole scenario. Then each of our divisions had the deputy commissioner for that division and their designees have access to that data within their divisions. And then we have people that coordinate assignments. When a new person comes in, part of their HR process when they're signed up is they're given an emergency role. And so the HR person that fills out the form, they say, well, I think they belong here, and then it goes into the system. And then the person that owns that role will look at the person and they'll say, well, they're really not what we're looking for. I'm gonna kick them over here. And we as emergency preparedness we talk to the people and we say, well, they belong here. And then they go into a training cycle. So it really is part of the integrated hiring process of the agency. Yes?
Okay, so my question is about, I know you mentioned that some grants are saying that people can't help in emergency, USDA being one. Did NACCHO go into that at all to figure out, how to get these other people, federal government programs playing with emergency preparedness in emergency?
That's a great thing for nature to do. I'm totally helpful.
We haven't yet. We feel that could be something that we could look at over the next year.
And then the question was asking NACCHO or another federal entity, I guess, to break down which contracts can be used for which emergency responsibilities. And so, we were given that as an assignment. Emergency preparedness, go out and figure out which contracts you can use for emergencies and which ones you can. And it's dizzying. I mean, it depends on the contract owner and their willingness as well as the grantee, as well as the holder of the contract. So there are lots of parties involved.
Because in Georgia, we're having a problem with WIC and USDA. Not one of their clerks or WIC clerks or whatever to participate in emergency drills next month.
Yeah, it would be great to have contractual guidance on that. There was actually sir.
Going back to that previous question, can you ensure current accuracy with that database?
Oh yeah, what's interesting is H1N1, we mobilized nurses. And what we found is we have 1,800 public health nurses. Of them, about something like 700 of them had put in their boss's phone number instead of their phone number, so that the nurse managers were getting, dozens and dozens of robocalls. So what we did was, we tried to learn from that, and we instituted a drilling system. So now we run notification drills using that information on both the leadership and also what we call core responders, those people who are mostly called out for response, and the nurses in particular. And we got our commissioner to sign off on, we will send each deputy commissioner a letter every month saying, okay, these are the people that did not respond to the drill because their information is incorrect. And boy, that percentage compliance shot up over 6 or 7 months. We're now at about 93%, 94% compliance. But it took us a couple of years to institute and execute that drilling process. Drilling is great, I love it. Yes, sir.
Sorry, could you repeat the question?
Oh, I forgot to repeat the question.
Microphones, just so that we can come up.
Yeah. So that question was, how do we know that our database is accurate? So for everybody out there, that my whole spiel about nurse managers was about how we got that contact information to be accurate in the database.
So Jeff Quinn, Southern Nevada Health District, Las Vegas, Nevada. I like that you guys got down to the individual things. Working with people, they always want to know what their specific things. But what's the next thing, your continuity of operation? Because by going down to that level, people will say that's not my job. You scale it down, you assign them a task, a position, but sometimes your health department needs the flexibility to use those positions in multiple roles or use them for something that's not specifically in the criteria of their thing. So you have a pool of people that are Renaissance people that really have multiple things.
So the question was, okay, you guys have assigned everybody to these specific jobs, but emergencies are flexible, and they're not always going to need to do that job. They're going to have another job they're assigned. How do you deal with that? It's in the weeds a little bit, so you got to follow me around the room. Okay, so in our system, we have, it's like a continuum where on the one side is ICS and the other side is COOP. We've worked to develop our 27 essential services and the staff needed for those. And those guys don't have an ICS assignment, they have a COOP assignment, they stay over there. And then in the middle, we have this bucket of people we call Tier 1, Tier 2, that have kind of both of those assignments. And the idea is they're deployed for ICS unless COOP needs them, and then they'll stay with their essential service. Which is a little complicated the first time you hear it, but essentially, you know your job, and you're either doing your regular job or you're doing your emergency. So that covers half of it. But the other thing is, sometimes you need, like canvassing, when we had to do canvassing. It's a new job, we don't have a role for it in our emergency, who do we get? And that's where the survey that we did came in. And we have this other thing, so don't let this blow your mind, but it's called an ICS qualification. That's kind of a thing that we have assigned to people that's not tied to their assignment, but it tells us that they have a particular needed skill. They're a data analyst, or they are part of our social media monitoring team, so they're trained and on that team. And so those are the people that get redeployed for these kind of critical operational task forces. We have another one that's called an operational planner, and that's like a poor soul that gets dumped into a new operation to try and make it make sense. We have like special teams like that are deployed over. So it's a tough balance between these hard assignments and flexibility, because you really need both of them. Yes.
So I have a question about communications. Working for an institution that has 120 years of tradition unimpeded by progress. We have a black site, and I'm sure it's great. I've never seen it, but I've been told it's great. I like your idea about having essentially a blog site, a WordPress site. I think that makes tremendous amount of sense. But how do you go about convincing people who don't necessarily speak technology and are very worried that anything that there could be any creep, if anyone could possibly even remotely be able to play into anything that wasn't passed through the 15 levels of command and control that are already in place? How do you go about convincing those people?
The question was, how do we convince folks that this idea of using an incident-specific website is a good idea, especially because I think a lot of us at the executive level don't have the technological know-how of our IT teams and our communication teams and a lot of the folks here. classy, good-looking folks. Really, my best advice is it comes down to learning from others' mistakes. I think Mitch is in an unusual situation where they have more than their fair share of situations where they have the opportunity to run into problems. So they learn to do a lot quicker. It's New York. I'm from Philly, come on. Barring some sort of breakdown of your communication system, it's really learning from what's going on around the country, which is why when I do these presentations, they're chock full of stories. Because it's only when we see that Calgary Edmonton lost all access to communicating with the public except via the media in the middle of a flood that their entire downtown was under feet of water. And being able to see that these things happen, and they don't happen irregularly. Another great example was after the Boston Marathon bombing, the FBI put up the pictures of the suspected bombers. And I remember this specifically because it went online at 5 p.m., and their website was down until 8 p.m. This is the FBI, they have way more servers than you do, I promise. They can handle these things. But it's just being able to point the executive to these stories and show the things that other agencies have had to go through to try to communicate with their public. And then being able to point to websites like WordPress or Blogger and point to their 99.999% uptime and the fact that they have literally millions and millions and millions of visitors every day. So it's a little bit of balancing. These are the data, but I think for the most part, our executives aren't going to fall for that. They need the stories. They need to see the crash and burn, and we just hope it doesn't happen to us.
Can I piggyback to add to what you had just said? I'm in grad school and I'm in the process of doing case analysis on PR and how IT was not used and how it went very sideways very quickly. And one of the cases that came out of the BP oil case, the oil spill, the gentleman who was the CEO was an engineer, was very technical, very abrupt communicator, not at all good at getting the right message out, and it really, really stained BP's response to that. And a lot of people wondering why wasn't social media used, and so that might be some fuel for your fire to show that we don't want to be that guy. We want to be proactive because people expect to be able to see and to get information quickly.
The comment was about the BP oil spill and how the CEO of BP was not the smoothest speaker. And if social media could have been used more to kind of get around that. And I actually would like to point to BP too as almost a success story.
Yeah.
They did, how they responded eventually, the first couple days and weeks afterwards, not pretty, but eventually they were able to contract with a company that put together essentially an incident website, and it was virtually hosted, so the site never went down, even with millions of hits a day and live video streaming of the oil spill as it was happening. And that's really where kind of the idea of developing incident-specific websites come from, is this company that does it. And so sure, you can pay tens of thousands of dollars a month to get access to it, but I think there's another way that's free to get that.
Hi, I have a question from the Google Hangout viewer. Who would like to know how to engage with partners who might have different processes during an emergency than your health department would.
All right, so the question was, how do we engage with partners that might have different processes than our own government? So that's really a fascinating question. Inherently, when we walked into the room to form our COAB, we said that we're probably going to disagree. In fact, we expect disagreement. Because if we're not disagreeing in a room of 45 agencies, chances are we're not being completely upfront and honest. So that's kind of something that you have to understand in the process. That's something that we know will be inherent in that interaction and that multi-agency planning. Really, even as I traverse the boundaries between public health and emergency management, processes are different, and they're going to be. So the biggest thing I think is when you look at the types of collaboration and returns that we're trying to achieve, is understand what is the baseline. So on the emergency management side or the public health side, what are the baseline requirements that each one of the parties need, or if it's multiple parties, what is that baseline? So what are we regulated to do? What does our grant require us to do? And then kind of start from there. So you see what everybody, kind of put it all out there on the table and say, at a minimum, the health department needs to do this, and at a minimum, the nonprofit agency in the co-ed needs to do this, and then kind of compile that and then go from there. And that's really the biggest thing, and then it's going to be a process of that interaction, negotiation, and so on. But in order to achieve that, we really spent a lot